r/AskReddit. Autopsy doctors of Reddit. What was the biggest revelation you had to a person's death after you carried out the procedure? Assisted with a post-mortem. When I was a student, female patient died in her 40s. Her medical history had extensive complaints of abdominal pains. One doctor even referred to her as a hypochondriac and others commented on apparent anxiety. Opened her abdomen, and she had extensive scar tissue. She was absolutely massacred inside from endometriosis. She suffered for decades and never got referred for a laparoscopy. She didn't have fucking anxiety, she had a medical condition. Edit. A few clarifications. Patient cause of death was unrelated. I won't give any details because it may get too identifying. I'm UK based and this was an NHS post-mortem. Patient did not have diagnosed anxiety. Doctors referred to her anxiety only in relation to her abdominal pain complaints. No other known history. Thank you for sharing your stories with me and others. I will take the time to read every one. When my parents were in medical school, they attended an autopsy of a patient who had died in a car accident. Autopsy revealed that apparently this guy had survived a chest shot in Vietnam years ago that the surgeon/medics left in rather than perform risky surgery. The accident had migrated the bullet to his heart and was ruled the cause of death. Last casualty of the Vietnam War. This was actually in the 90s a bit, before I was born actually. This does make me wonder if there's a possibility for other Vietnam veterans or Korean War veterans to possibly have a similar situation or straight up lead poisoning. Or in the future, if there's a chance for this to happen to Iraq or Afghanistan veterans. Not mine but a doctor I used to work with. Back when he was in school, he would do his cadaver labs really late at night to many people during the day. One time it was really late, around 2 AM. He was listening to his lecture on his headphones and he saw the cadaver's arm move/twitch. He thought it was just his mind playing tricks on him. Then he saw it again. Proceeded to run away in a panic. He told a few of his classmates what happened but nobody believed him. Next day they had a group cadaver lab with the same cadaver. The arm twitched yet again. The professor did some digging, and it turns out the patient's pacemaker was still fully functional and occasionally fired, causing the arm twitch. He was so relieved. He thought there was a zombie in there. I may be late to the party, but I finally have a good story to tell. In medical school, my group's cadaver was an 80-plus-year-old female who was extremely unfit, morbidly obese with muscles half the size of any other cadavers. Her pectoral muscles were paper thin. To get some reference, we figured she was bedridden during her last few months, which would somewhat explain these findings. When we started on urology unit and began to dissect the infratemporal fossa, I discovered a small metal pellet under the skin behind her right ear. My tankmates and I went on to find dozens of these metal pellets strewn around her head's anatomy, with some lodged into the cranium and others in the bones of her face. We contacted her living relatives to get some clarification and they ended up revealing that when this lady and her brother were children, they said she was 8 years old. They were playing with an old decorative rifle that the family had mounted above the fireplace. Long story short, the brother accidentally discharged the rifle into the girl's face. The aftermath was this lady was blind and wheelchair bound for the rest of her life, and the pellets weren't all removed. It was an interesting dissection with that information from then on, but a sobering moment in reminding our class that our cadavers are humans with their own struggles and rich lives. If you're considering donating your body to science, please know that we don't take the responsibility lightly, and a million thanks aren't enough. I have more stories, if anyone is curious. Edit. I should add that her granddaughter made a point of saying this lady did not hold a grudge on her brother, and they lived full lives on happy terms. My old martial art instructor was a policeman in the 80s. He was shot with birdshot in his torso and many of the pellets were not removed. He said that sometimes they make their way to the surface and he can just scratch them out. My friend once cremated a lady, and when they pulled the table out there were 3 sets of forceps sitting there. Most likely she died in surgery, but I always thought it was crazy those were left in, and whatever metal they are made of clearly has a higher melting point than cremation temps. After my mother was cremated, my sister was curious and wanted to take a peek at her ashes inside the urn. She opened it and said, "Oh." Right on top of these fine ashes was the hardware from the broken ankle repair she had gotten years before. My friend had to do an autopsy on a baby. The dad claimed she died after rolling off a couch. My friend found that the kid was slammed against a hard surface multiple times. Dad eventually admitted he hit the baby against the wall after she wouldn't stop crying. My friend had to quit that job cause it was so taxing mentally. While in medical school, we had to observe an autopsy and could assist. One of the lectures was to observe forehead trauma. You do this by hitting the skull with a hard object, scissor or the like. A hollow sound is normal, but a dull sound indicates trauma. One of the other students did this exam and found a dull sound. The coroner had not yet himself examined the person and was very surprised as he had not been informed by the police of head trauma. They then continued to examine the head and they found a gunshot wound through the skull. All of a sudden the person was a crime scene and they had to call the police again and leave the person as into shade as possible. I believe it was later confirmed that the person had shot himself, but it could have been a murder. Edit. This blew up. Thanks for all the upvotes. As someone pointed out, there must have been some information that was missed between the police and coroner. I myself was not present, but I do believe the story is true, as it is now a lecture in why you should always examine for skull trauma and not just assume something before knowing. Also edit. There seemed to be a lot of interest, so I have added another story which is unfortunately true, but crazy. How do you miss a gunshot wound to the head? Edit. And if the person did commit suicide by gun, then the gun would be with the body, right? Like a dead person with a gun in their hand isn't a clue at all. Second edit. Obviously the question is rhetorical. Stop asking me if I'm blind to the poor quality of police. You don't aim properly. Masters in forensic pathology here. You'd be surprised to know the number of people that have life-threatening issues that never went diagnosed and that they didn't die from. Seen an older guy who died of pneumonia in hospital. On autopsy the guy had both an enlarged heart and a couple of medium-sized aneurysms in the brain. Another guy in his 70s apparently came into the ER and had chest pain, then died shortly after. Dies of a heart attack, but also had cancer. In less natural circumstances though, saw a guy who had been shot in the head a couple of times. 3 definite entries and a blown out skull, but police only found 1 bullet. Couldn't find the other bullet in his head at all. Assumed the police missed it. Went on as normal with the autopsy until we got to the chest cavity. The other bullet was just chilling beside his lung. Turns out it entered the skull, hit the inside, ricocheted down his neck, and into the chest. That was pretty wild. It's so wild to me how on the one side, humans can be so resilient and survive horrible things, and on the other side just how fragile and quick life can be taken from us. 2 very different extremes. Thanks for sharing your perspective. Yikes, I'm a veterinarian and sometimes I do necropsy, basically autopsy for animals, and one of the more notable case involved a prized Wagyu cow that died mysteriously. Wagyu cows are very expensive to rear and fetch a good price at the slaughterhouse. After cutting her open, I found metal wires extending from her stomach into her heart. It's what we call "hardware disease." Apparently the cow decided that eating metal wires for constructing fences was a good idea. Normally the farmhands are quite good at keeping these hazards away from the inquisitive bovines, but I guess slip up do happen from time to time. I took forensic lectures, so I saw quite a bit of crazy shit, but the things that stick is an autopsy revealing a history of abuse, pain, and violence. A little more funny, a skeleton was found in the near mountains. It was very clear he died in an accident 20 plus years ago, however he had to be identified via DNA. Turned out his dad was not his dad, but his uncle. Sparked a whole public family drama show, cause the family was well known in my area. Not exactly an autopsy per se, but it was a patient found unresponsive, with CPR in progress by EMS. The man was clearly homeless. Based on his appearance and smell, he reportedly had not been seen for several days by his friends, and was eventually found behind a fast food restaurant dumpster. We were briefly able to get a pulse back, and when the nurse cut his pants off to place a catheter we saw the cause. He had fashioned some sort of makeshift cock ring out of the neck of a plastic bottle. It was way too tight and completely cut off the circulation. The penis was fully black and necrotic. I did a bedside ultrasound and found his abdomen full of free fluid, which is bad. Most likely his bladder had ruptured from being unable to urinate for days. His lab suggested he was in septic shock and full-blown renal failure as well. He did not survive much longer than that. Edit. I remembered another one. In my final year of training we had a cadaver lab to practice advanced airway management techniques. For instance, difficult intubation, cricothyroidotomy, etc. While I was helping an intern do a basic intubation, she commented the tube wouldn't pass. I think she has some kind of growth or mass in her airway. I took a look, asked for some forceps, and pulled a half-eaten hot dog out of her larynx. It of course had been embalmed along with the rest of her. Cause of death identified. My wife is a pathologist assistant and during her schooling carried out the autopsy of a newborn that died minutes after birth. The mother was desperate for a child and had a history of multiple miscarriages at different terms. This was her first time making it full term and all prenatal checkups revealed no problems. The delivery was difficult but successful and baby was alive for a short time. Skip to autopsy. All signs point to baby being fully developed. Get to the abdominal cavity and the liver is lacerated and hemorrhage everywhere. During the difficult delivery the resident used too much force with the forceps to pull the baby out. The ruptured liver that caused the baby to bleed out internally. Wife was enthusiastic about autopsy up to this point. Now has no interest. Sheep farmer. I have to know how to do a necropsy for when something dies to know if it's something that could spread. Had a ewe fall over dead after losing a ton of weight and after treating her for everything under the sun. She would gasp for air and struggle to breathe but antibiotics, steroids and anti-inflammatory drugs didn't touch it. She finally passed away and I cut her open to see what the hell happened fully expecting to see her lungs riddled with shit. Her heart was 5 times the normal size and hard as a river stone. My guess is she'd had that issue her whole life and it didn't kill her until she was 2. My dad used to perform autopsies. His best story was that they were brought a body that has no real indication of any issues. After examining the body, the only thing of note was that there was blood coming out of the guy's rectum. They begin the autopsy and the guy's organs are completely liquefied and the body cavity is filled with lead shot. It became apparent really quickly that someone had shoved a shotgun up his ass and pulled the trigger. This was in the 70s, and I still have to wonder what this guy did to piss someone off enough to get a shotgun up his ass. This story circulates every year at my medical school. A body came in with a gunshot wound to the chest. There was no exit wound. They tried to locate the bullet during the autopsy. No success. They then did a whole scan, x-ray, or court of the upper chest/abdomen/pelvis. No bullet point. At that point someone said fuck it, let's scan the whole body. Lo and behold, the bullet was detected in the popliteal fossa area behind the knee. It had embolized/traveled from the heart all the way down the arterial system to the knee, where it got stuck in one of the narrower blood vessels. Training in the medical examiner's office. Elderly woman found dead by herself in her home. There was nothing suspicious, so I was given the case. Took out all the organs, dissected everything, completely unremarkable. I cut through the larynx as a last step before I could clean up and finish the case and boom, giant piece of chicken lodged in her windpipe. Died choking on dinner. I'm single and happy being single, and honestly I think about that scenario too often. Choking on my food, dying alone in my apartment, my cat eating my face.